Good morning, everyone, and welcome back to the Compass One podcast series here at the Vizient Connection Summit. We have a jam-packed day full of amazing podcasts in store for you. And we are going to kick everything off with my two guests right here. We're going to be talking about menu revolution, driving metrics with menu engineering. And there's no two better people to talk about that than our two guests. First up is Gina Damon. Gina is the president of operational support for Compass One Healthcare. Her teams are responsible for the company's clinical nutrition and wellness, culinary retail, patient experience, marketing, and nursing engagement support teams. Gina, thank you for being here.
Thanks for having me.
And also joining us is Chef Kevin Dorr. He is the Senior Vice President of Culinary Strategy and Innovation for Morrison Healthcare. Kevin is the senior, in his role, Kevin defines and executes Morrison Healthcare's culinary strategy and supports over 1,000 client locations. His teams work closely with Morrison operations and partners to ensure the goals and visions align while working to make the cafe an everyday destination for hospital caregivers and guests.
Well, thanks for the intro.
I'm telling you, that's a pretty good intro for both of you right there, right? Let's just jump right into it. Gina, what does menu engineering mean in a healthcare setting?
Well, it shouldn't mean anything different than it would mean in a regular retail setting, right?
Okay.
In a restaurant setting. But traditionally in healthcare, and what we're trying to move from is we want to have more of a focus on data and analytics and the consumer experience and really treat our patients like consumers. Patients have expectations. Just because you're admitted to a hospital tomorrow doesn't mean that you don't have those same preferences that you did yesterday. And we really want to tap into that and use that experience to drive metrics that matter.
Okay. Kevin, you want to elaborate on that a little bit?
Yeah, I think really just kind of leaning on what's happening in the industry. You know, healthcare's not always been on the cutting edge of food service, to be honest with you, let's be frank.
Sure.
But I think, menu engineering has been around for a long time. Restaurant 101 would tell you, to lean in on things that your customers love, leverage the data to find out what needs to come off. And I think the customers are so educated now around food, more than they ever have been. We got an opportunity to make sure the menus are fresh, as food trends continue to change over time.
Speaking of the customers, I know you oversee the retail and patient culinary strategy. How do these programs different when you talk about the healthcare setting?
Yeah, at the risk of getting in trouble, I'll probably lean on a line from politics these days to say that there's a lot more things in common than there are different, to be honest with you. Food is food. They are real customers, know. And I think both have something to learn from each other. I think on our retail side, everybody's not happy and healthy from our customer standpoint there either. Some people are diabetic. Some people may have high blood pressure. So there could be some more balanced clinical foods on the retail setting. And on the patient side, probably needs to be a little less clinical. Because at the end of the day, food is such an important part, of the healing process. And it's got to be delicious. When you think about foods on a spreadsheet to say it has this many calories, this much sodium, it still has food that people are choosing to eat. And it really does have to be delicious to get that, nutrition inside their body and actually help the healing process. And I think it's an important part of the puzzle. The other thing is, I think, streamlining some of those things from the back of the house to make sure that we're just serving great food, whether that be a patient or a retail. Much of the focus for culinary in the past have been kind of on the retail side. The clinical teams will do the patient sides, and we are kind of bringing all of that under one umbrella. It makes so much sense in the back of the house, and it makes it a lot easier for our customers to choose as well.
I heard you say the word streamlining. So you're streamlining the menus, but why doesn't more options always equate to a better outcome?
It's actually just the opposite, other than maybe a Cheesecake Factory that's out there that has a giant book of menu options. The truth is, especially in a healthcare setting for patients, they really don't want so many choices. It's overwhelming. They've got a lot going on. Food is one place that they can have some comfort.
Sure.
And I think streamlining those things, also, it has a lot to do with a bit of a menu design. So it's not just what is on the menu, how that is laid out. Sometimes healthcare, the setting has been a bit more of a list of menu items. It's a paragraph. It's giant pages of all these options, and it's overwhelming for customers. So there is definitely an art and science to menu design. So it also allows our teams to do a better job in the back of the house. Having 100 menu items
Sure, that
with the
makes
same
sense.
amount of cooks is not setting them up for success. And so you start to do a lot of things mediocre, then a few things really, really well. And it also allows us to kind of give a little bit of an aha moment where somebody says, hey, I didn't see a grilled cheese on your menu. Can I make you one? It allows you to kind of give a little bit more of that human experience to say, yes, we'll take care of you. You don't have to put every item that's ever been in your kitchen on a menu. And I think there's a bit of an art and science and a balancing act to some of those things.
And you guys customize your menus too for different regions of the country, right? So they're different to appease to that clientele.
I have to. I mean, we know there's some winners, the 80-20 rule, that 80% of the business, we know a Caesar salad or some of these home run dishes that would be, do well across the country. But we also know that the menu in Texas had better have some things different than New York City versus a rural hospital in Mississippi. And it's really important to make sure that, the menus reflect the folks in those communities because it also knows that we're paying attention. And I think the data that Gina has spoke of already doesn't lie. We know what consumers are eating, what kind of restaurants are in there, what they're buying from the grocery store even. And all of those, we take into consideration. We do some menu development.
Yeah. Speaking of data, I know, Gina, earlier you talked about technology and data. How do our systems help drive standardization and these types of impressive results?
Yeah. So for us, it really starts with our patient dining ecosystem, just really connected system from patient ordering to our menu management to purchasing. And, we talked a lot about data, but we've had hundreds of millions of meals placed through our patient dining system. And that data is really powerful. I mean, and Kevin mentioned it. So we know we can look at what trends are nationally, regionally. We can cut the data by various patient demographics. We can overlay all of our retail sales data and then just general consumer retail data in the region. And the best part about it is it's just taken all the guesswork out. So we can get to the point now with our menus, even if streamlined, that we know our recommendations will make a mark. And, and I think that's the important part. And again, that integration outside of the right menu options really drives safety too. And, Kevin touched on this. It's, simplification in the data, it sounds technical, but what it's really allowed us to do is be really flexible. He mentioned the grilled cheese example. We can really drive hospitality in a very different way when you think about this underlying infrastructure. So what do we want to do for menu? What's that overall menu that you would have at the hospital? How might you customize that for a certain patient set? So think about labor and delivery. Maybe the way they order and the options that you provide to them are different. And then how do you get down to that individual personalized experience that just fits that, patient's needs? And I think that's the magic of the systems and the data that allow us to do that.
Yeah, because I think that's the future is personalized nutrition,
Sure.
right? Yes, they are all patients, but man, you talk about whether you're talking about pediatric or maternity or someone with heart disease or someone that just simply broke their leg, you can't treat them all the same.
That's right. That's right.
They don't all have the same needs. And I think a great example of that is the work we did with the major health system recently. They had 28, speaking of streamlining, they had 28 hospitals, and they were big and bold enough to say, hey, we are looking to drive some consistency and standardization throughout the business.
Okay.
And it's not often we get clients that are ready to go all the way. And they were like, in order for us to be the brand we want to be in the community, we understand the food is medicine and what role that plays. We were able to roll out one single menu, obviously tweaked a little bit for regionality, across 28 hospitals on one single day.
Wow.
It made all the difference in the world for our teams to be able to execute, because now we're all kind of holding hands and doing the same things at the same way. It allowed us to execute at such a high level around standardization, and the results haven't lied. I think the hospitality scores are up, quality of food scores are up, food costs is continuing to be better and better. And so there's some real power in the consistency and standardization across the business.
Yeah, that's impressive for sure. Gina, what about your clinical dietitians? What are they seeing?
I mean, they've been thrilled, frankly, about where we're at. I mean, they've had a seat at the table with Kevin and team for the example that he just mentioned. But in general, they work very closely hand in hand because it's safety, it's nutritionals. It's also just a great menu. And I think for them, streamlining really allowed us to step back and say, what do we need that's the best, right? So it's back to that. There was more power in streamlining and standardizing because we could take a hard look at what we had and then make sure that those best items, that delicious food, could spread across the majority of our diets, right? So from a dietitian perspective, that's great for them because their patients, regardless of the diet they're prescribed, can have a delicious meal. And I think that's what it's made their job easier, I think.
Yeah, there's been a lot of power in, the partnership between the clinical and the culinary. We have clinicians and dietitians that are chefs and chefs that are dietitians. It's really the best of both worlds because, food, the nutrition is not nutrition until you eat it. And so you got to get past the spreadsheets of the calorie content, et cetera, and making sure that it is a balance between both sides of the ball. And I think it really is. I think our chefs learned a ton from our dietitians that keep us honest and help us know what, those patients need to heal. And our culinarians teach the dietitians a ton, about, hey, we've also got to make this, yes, clinically, appropriate and correct, but it's also got to be great. And there's so much more to, getting the nutrition because there's a million things before the food. The chef in me will always say, hey, it's all about only the food. But man, it is about what that printed menu looks like. I talked a little bit about menu design. It has to do with what that tray looks like. When you open the lid and you say, voila, how appetizing does it look? What is the aroma, the appearance, the plate presentation? There's a million things that happen before you actually eat the food. Mm-hmm. And the truth is, many of those people, none of those patients came there to eat. It is a necessary evil,
That's right?
And so they may not be in the mood. They may not feel that good. So the human experience component of it is a really important, every bit as much as the food on the plate.
Well, let's face it too. Like, so I'm assuming like most of the meals that come to their room are the highlight of their day. Really?
Yes.
Right.
It's the one thing they kind of have some control over, and that's why we've encouraged our chefs so much to get up on the floors and do the rounding. I mean, that white coat experience.
Right.
When you're laying in the bed, you're not feeling so hot, and you have an opportunity to speak to the chef. One, to know there is a chef in healthcare setting is cool, right? And two, many times they're asking for really simple things that our chefs can kind of go make happen. And that allows us to kind of bring some of that, human experience back.
Let me ask you, Kevin, about your culinary team and now that you're streamlining. How are they reacting to it? What is their take on it?
I've never, in the history of organization, never seen more passion and energy around the patient component.
Yeah.
Many times I'd have said, hey, what are the chefs working on? They would have shown me a picture of a great catering that they did for the president maybe, or they'd have shown me something cool they did in retail, but rarely would it have been on the patient side. And I got to tell you, the last several years, it's been amazing the energy that new menu development has brought back to our teams on the patient side. We're just coming off an amazing week, which is one of my favorite weeks for our company, which is Chef's Appreciation Week, which celebrated hundreds and hundreds of chefs across the country. And we have a little bit of a healthy competition, between chefs, and all of that continues to drive more and more innovation around how we do what we do on the patient side. And it's been a whole lot of fun to see kind of just the renewed energy. And in the back of the house, many of those people have been working there for a long time in healthcare. They stick around.
Yeah.
Many times the same person's been making the salads the same way for 10 years or so. Changing that menu also energizes some of that, right? It also, on the client side, lets people know that you understand the power of food and medicine as medicine. And I think it sends a really clear message throughout the whole hospital about, hey, we're pretty serious about the food nutrition thing. This is not just the food service people, dietary down the hallway.
Right.
These people are partners of ours, and I think that partnership is really important.
Gina, do you see the same results from the clients side?
Yeah, I mean, at risk of repeating what Kevin said, I'll just reinforce it. It's great to see how re-energized our teams are about what they're doing. It's the menu choices, but it's just that pride in what's on the plate, and that's just really exciting. And I think our partners are excited as well, From a nurse's perspective, when you think about alignment from retail choices to a patient menu, they can now speak to patients about what's on the menu and share their personal preferences, and being able to engage around that and have that connection. Supply chain really likes the simplified ordering guides, and that we can really manage cost and consistency. And so, I just think it's great that at all levels of the organization, a senior leader, a CEO, your COOs, down to our frontline teams at all levels, all excited about the same program, is pretty cool. And,
it is.
The results show it. I mean, Kevin touched on this some. Our quality of food results across the company have improved quarter after quarter for almost 2 years now. And so, I mean, the metrics don't lie, which, at the end of the day, we want to drive that great patient experience. We can have this cool new menu, but if it doesn't lead to a better experience, why do it? And the fact that it has, it's pretty exciting.
Yeah.
And I think all of this makes, one of the mantras that I've used the past couple of years is making room for the good stuff. It has made more room, right? As tastes change, as things change. If you don't at some point kind of clean out your closet of old menu items, of old recipes, do we really need 45 different green bean recipes at the end of the day? The answer is absolutely not. What we need is a few great ones, right? And I think allowing our chefs a little more room to have, strawberry filled salad in the summer and a fall harvest salad in the fall. We should be eating in that way, right? And if you have all of these menu items, it clouds what our customers can see. And I think it's an awesome opportunity to make a little more room for some of the good stuff. And it's made a big difference for our teams and our customers.
And to your point, I mean, that your teams have done a great job bringing in those seasonal specials and LTOs and just, again, more excitement and that consumer experience. What would you experience in a restaurant? You have that seasonal special. You have your winter soup. Why can't you as a patient have that same experience?
Yeah, who would have thought we were ever going to be doing limited time offers for patients? Right. It's been incredible.
Yeah.
We leverage some of the, talking about the, the retail and the patient side, we leverage some of the same excitement that we got on the retail side that restaurants have been doing for 100 years around limited time offers and bringing things in and out of the menus, doing that same thing for patients to where, especially for those frequent flyers that are maybe staying there regularly or coming often, unfortunately. It allows them to have something fresh.
Yeah. My last question for you both, and we'll exit the dock here, is what about any of our partners that haven't really done the menu change yet? What advice would you give to them, or how would you encourage them to take that step?
I mean, as excited as we are and energized about the outcomes we've received, I think you just can't underestimate that change is hard, right? Yeah. It takes a lot of work. A lot of work has gone into this. But if you have a partner with the technology and connected systems, with the data and benchmarking, with the support that all makes it come together, that's where, what you really have to think about. You have to have someone that can partner with you along those dimensions. And just that, again, that infrastructure, we're talking about great food, we're talking about experience scores, but it's really that connected infrastructure underneath that allows that to happen, allows that flexibility, allows that hospitality. So I think as you think about making the change, you have to consider that it's not just that end result, it's all the things behind it that makes it happen.
Yeah, I love that. And there's so many. I mean, change is definitely hard, right? And I think it's not as easy as sometimes people like to think. But I'd also say there is some pain in not making some changes too, right? And staying with the same old thing, right? You're making a decision either way, one way or another. And I think it's an awesome opportunity. A couple of things I would say about it is it's a great opportunity to bring everybody kind of under the tent, so this is great for nursing engagement, to bring the clinical teams, to bring, the hospital leadership, to bring frontline employees, to where when you make a change, you're not quietly making a change on the menu, you're making a big deal out of it and kind of putting your stake in the ground about what your food represents for your brand. I think it is one. Two, it is cleaning out your closet a bit and making room for the good stuff, man. It's important to keep these menus fresh over time. When we think hospitals, you think about, the average age may be 75. Well, those folks were born in 1950. It wasn't in the Great Depression. Right? 75 is not as old as it once was, I think, right? We can all agree. Right. They were 20 years old in the 70s and 40 in 1990. These folks are well-traveled, depending on what kind of market they are, they know their food. And so they're demanding something very different from that patient experience. And I think ultimately it's just about finding the right partner that can help kind of hold hands with you and make those big moves. So that's made all the difference for us.
Yeah. Great stuff from both of you. Thank you so much for joining us up here on the dock. Hope you had a good time at our podcast. But just fascinating stuff. And Morrison is definitely just leading the way with it when it comes to the food and the hospitals. And like you said to begin with, wasn't always the brightest talking point, but now it is. And you guys are changing that. So thank you very much. And thanks for joining us.
Super. Thanks for having us.
You're welcome.
Yeah.